All right, so my name is Connor. Connor Jackson. I'm with One Digital. So we are the insurance consultants for City of Miami Springs. We are also a resource to you all as employees as well. We are your advocates. So keep that in mind as we're going through this process. I also have Christina with UHC on the call with us as well, who will be going over your benefits. We will be making the change to UHC this year, and that is going to be for medical, dental, and vision. And that is mainly because Humana, discontinued their group policies. So we had to make a move, and UHC made a great offer. So that is who we decided to go with. Keep in mind as we're going through any amounts you've already put towards your deductible will be credited to the new policy, and everything will reset on January 1st as it has in the past as well. Okay. So we'll be going over your benefits that will be effective October 1st and will run through September of next year. All right. Before I get into it, I do have to just give a little disclosure that the following presentation is intended to inform you about your benefits, and every effort has been made to ensure that the presentation accurately reflects your benefits. However, if there do happen to be any discrepancies between the terms in this presentation and the terms in the benefit plan documents, those official plan documents will always take precedent. All right. And those plan documents have been made available to you through the benefit guide. There are complete summaries for all plans within that. So if you have any questions, you can refer to those. They're pretty, have a lot of good information on them. All right, so what we'll be discussing, we're going to be going over open enrollment, of course. We're going to be going over your benefits, new and old. And then we'll go over what next steps will be, what you'll need to do as an employee, and then, open up the floor to any questions. But also, as we're going through the presentation, we kind of want this to be more of an open forum. So if anyone has any questions as we're going through the presentation, please feel free to put them in the chat. Go ahead and speak up if you have a mic, so we can address those questions as we're going through. All right, so the open enrollment period is going to be through today, September 9th, and will run through September 20th. All right, again, the coverage is going to be effective on October 1st, and it's going to run through the end of September of next year. All right, again, we are moving the medical, dental, and vision to United Healthcare. And that's going to make it a lot more convenient for you as well, since everything's going to be with one carrier. There's some coordination of care going on there between the medical, dental, and vision, things like claims, things like that. So it'll make it a little more convenient for you as well. Okay. All right, so I'm sure everyone here has gone through open enrollment before, so this is probably not a new thing to you, but some things to keep in mind as you're going through. Make sure to review your elections, okay? This is going to be the only chance outside of a qualifying life event for you to make any changes to your insurance, okay? So make sure you're double, maybe even triple checking your elections. Make sure you're enrolled in the right stuff, you have the right dependents covered, that kind of thing. All right, now qualifying life event, that's going to be things like marriage, death of a spouse or a dependent, birth or adoption of a child, if you were to gain or lose coverage elsewhere. All those things are considered qualifying life events. So if you have one of those things happen to you, you can make a change within the middle of the plan year. You just need to make sure you let HR know within 30 days of that happening, so that they can make your change effective for the correct date and get you all processed. Okay. Make sure if you're covering someone new that you have their date of birth and their social security number ready so that you can add them to the coverage, because we will need those two things, of course, along with their name. All right, there is going to be a UHC enrollment form that everyone is going to have to fill out since we're moving to a new carrier. Everyone will need to fill out that UHC enrollment form, which is available through the benefit guide as well. And we've got digital copies of that too, that HR should be able to get to you. So just make sure you get that filled out. That's going to cover the medical, dental, and vision portions, all of those. And then, of course, just make sure you get those elections submitted by end of day on September 20th, so we can make sure everybody's enrollments gets processed and we get those ID cards out in a timely manner. Okay. All right. If anybody wants to scan this QR code up on the screen, this is going to lead you directly to your benefits guide. That's going to go over everything. It's going to have access to all the summaries, go over all your benefits, give you good tips, that kind of thing. So if you want to scan that now with your phone and bookmark it, you can have it available on your phone at any time. You can actually even download it into a PDF. So please feel free to do that. Okay. I know we're going to have some printed copies available here soon as well. All right. All right. So before we get into the medical piece, does anyone have any questions? I know I just went over quite a bit of information. So does anybody have any questions about what I just went over? Okay, great. All right, so as I said, we will be moving to UHC. The plans being offered to you are virtually identical to what was being offered through Humana. So really no changes there. There will be the 3 plan options, all right? The HMO with no deductible, the gold plan, the HMO with a $750 deductible, which is the silver plan, and then a point of service plan that has a slightly broader network that has a $750 deductible as well. And that plan also does have out-of-network benefits too. Okay. Something else to keep in mind is that you will need to list a primary care provider. All right. So that is going to be listed on that enrollment form when you fill it out. Just make sure that you list your doctor's name there. If your doctor was in network with Humana, chances are they will be in network with UHC as well. UHC has one of the best, if not the best, networks in Florida. So you shouldn't have an issue. But we'll also be going over how you can search for your provider in the UHC system even before you get your ID card and make sure that your primary care provider is in network. All right. So with that said, I'm going to go ahead and pass it over to Christina to start going over the benefits with you.
Thank you, Connor. Good morning, everyone. My name is Christina Arouse. I am the field account manager. I represent you on behalf of United Healthcare. I'm happy to be here today to talk to you guys about your medical insurance and the upcoming plan offerings. So as Connor was mentioning, there are 3 plan offerings. We have the gold, the silver, and the POS plan. As you can see here, we just have a brief overview of these plans. So the first column, the gold plan, that's going to be the HMO plan that has no annual deductible. So if you look at the yellow here or the sand color here, the main difference between the 3 plans. So the first plan is a copay based plan. So you mostly you won't see a deductible. You won't see mostly any coinsurance. It's mostly co-payments. So as you can see, if you were to go to a primary care visit, your copay would be $15. That would be your responsibility. Same thing with the specialist visit. You have a $15 copay. If you do need to go to an urgent care for those minor non-emergency situations, you would have just a $25 copay. And if you do have an emergency situation and you do have to elect to go to the emergency room, your copay under this plan would be $50. Inpatient hospital, as you can see, it'll be $500, and outpatient surgery is actually covered at 100%. You also have the prescription benefits down here. We currently are going to be on a 4-tier prescription plan. The first tier, those would be like your generic, some brand names. That'll be, a $10 copay. And as you go up in tiers, the price does change a little bit, but they are roughly the same across the 3 plans. So it'll go $10 copay, then your tier 2s would be the $40, and the more specialized drugs would be the $80, and specialty would be $160 copay. So moving on to the silver plan. This plan, it's a combination of both deductibles and copays. The annual deductible on this one for a single person would be $750. For a family, it'll be $1,500. And your out-of-pocket maximum here is going to be $2,250 per person, and you have a $5,500 family maximum. Um, Very similar to the first plan when it comes to the primary care visit and specialist visit, but it is a little bit more, it costs you a little bit more on your copays. So your primary care visit on the silver plan would be $25. If you do need to see a specialist, you know, like a dermatologist, that'll be a $50 copay. And then if you do need to seek urgent care, it'll be $50. And for the emergency room, that would be a $100 copay. The inpatient hospital, it's 100% covered after you've met your deductible. So you first have to meet the deductible and then the coverage kicks in at 100%. Same thing with your outpatient surgery visits, 100% covered after your deductible. And very similar, the prescription tier plan, also a 4-tier, and then you have your copays based on the tier. And then the final plan offering here is what we call the flex plan. So this one, you do have an annual deductible of $750 per person, $1,500 for the family. And the out-of-pocket maximum here is a little bit higher. For individuals, it'll be $2,750 per person and $5,500 for a family. So this one is just a mixture of all three. So a mixture of deductibles, co-insurance, and co-payments. Your primary care visit is going to be a $20 copay. Same copay for the specialist visit, so $20. If you do need to seek care at the urgent care, it'll be $50, and your emergency room would be a $100 copay. For the inpatient hospital, you would have to cover your deductible first, meet your deductible first, and then you would pay the 20% remaining. Same thing with the outpatient surgery. You would meet your deductible and then you would pay 20%. And then the prescription drugs is the same across the three plans. You know, your tier ones, your generics, that would be $10 copay. And then as you go up into the more specialty drugs, your copay does get a little bit higher. But essentially the same across the three plans. As mentioned, as you can see here, the main difference is how you, when you need care, how you're paying for it, whether that's copays, a mixture of a deductible and a copayment, or the mixture of all three, deductible, coinsurance, and copayments. And very important here, the deductible types are per person up to the family maximum. So each person has their own deductible, and then you can also combine that. You do have a combined maximum for the family. Okay.
And just a few things I want to touch on really quick before we move on to the next slide. Um, the POS plan, that is the suggested plan for retirees. Due to it having a slightly broader network and where the retirees may be located. So just a heads up there. In terms of rates, those are included in your benefit guide. So wanted to point that out as well. If you're curious to see what the rates are, you can check those in your benefit guide too. So.
I also wanted to reiterate on the two plans, the HMO plans, these are in-network coverage only. So you have to stay within the UHC network. If you go out of network on any of those two plans, you won't be covered. So very, very important. I always like to mention, you know, health insurance is very complicated. It only works as good as you make it work for yourself. So it is very important, as Connor mentioned earlier, to get onto the myuhc.com website and start looking up those providers. If you know you have upcoming medical appointments, start looking up those providers just to ensure that they are within the UHC network.
I have a question about that. What happens if an employee is out of town, gets hurt, and there isn't a UHC network coverage PCP or doctor that they can see in case of an emergency? What
So that is
happens
a
then?
very good question. So all of our plans, we do offer nationwide emergency coverage. So if there is a life-threatening emergency, even if you're out of state, if you're out of the network, you will be covered in emergency life-threatening situations. So it's not like you
But
can,
life threatened meaning you're dying, or life threat because
yeah, it
you
has
can
to
just
be an
break your
emergency.
bone, or yeah,
Yeah, it
but
has
you
to be
can
an
be at
emergency.
a
Yeah, it could be like a broken
I
bone.
understand. Oh, okay, but
It
that's not
just
life
can't be for like
threatening,
a
but it is.
cold. Yeah, it just can't be for like a
Oh, no,
cold.
no, I got it. Got it. No, I'm concerned because a lot of our employees have kids, and if something happens to them while they're out on vacation or something and it's out of the network, whether they would be covered or not. Thank you so much for answering that.
You're welcome. We also do have a really interesting benefit that I'll get into a little bit down in some of these slides. We have a virtual visit option. So in those situations where you are traveling, let's say you do get, a minor pink eye, you can, opt in for a virtual visit, and it's essentially at zero cost for those
Oh,
minor things.
I have a question also, if you don't mind.
Mhm.
Okay, if my daughter goes to a university out of the state of Florida, in reference to her primary doctor, does she have to pick one in the area she's at, or how does that work?
She would have it would go by your address. So the main it'll go by you since you're the primary member. It'll have to be a PCP within your location.
Okay, even though she's going to a university out of the state of Florida.
Correct.
Okay, right.
That sounded like Lázaro. That sounded like Lázaro.
If
That
that
might
is
be-
the case, I
that's a
guess
tr-
that you would have to, if you want her to be covered outside or wherever she is at, I guess you would have to choose the POS plan, which is a
Correct.
Florida plan, and it may cover her. Just heads up to the employees that are listening.
Sure.
Mhm.
And two, I mean, you can check even before you get your ID card, which we're going to go over on this slide. You're going to be able to check and see if certain doctors are in the network, in and outside of the state. So,
All right.
All right. So searching for a provider, the myuhc.com website is going to be your biggest tool. I like to promote the myuhc.com website as well as the United Healthcare app, because you can find essentially everything you need. As I mentioned, it's very important to do your research, especially with those who have upcoming doctor's appointments. This is the perfect place where you can go in, you can create an account, and you'll be able to find those providers. You can also look up care and the cost estimates. You can see the provider's address, any facilities, if you need imaging done. All of this will be found on the myuhc.com website. So this slide is just giving you a brief overview on how to search for a provider and how to search for primary care providers as well, because you do need to select a PCP on these plans. So very important, get onto the myuhc.com website, click on register now, then you would go to find care and cost. You would go on to the medical directory. But if you also do need a dentist, you can click on the dental registry as well as the vision, since we're going to be providing both medical, dental, and vision this year through United. Then you would click on people to locate the primary care physician. And you can also search by typing in the doctor name or the facility name as well. Even if you don't know the name, but you know the address, you can search through address as well. It has a really good filter system. So even by specialty, you can break it down. And if you already know your doctor's names, your medical groups, it'll just be that much easier.
I have a question.
sure.
Yes.
The timing of this, I have an appointment on the 2nd of October, an imaging appointment. When will we have the information on or our cards or whatnot to provide to the provider?
So you should have access to the digital ID card, because correct me if I'm wrong, Christina, the digital ID card will be ready before the card will be mailed to you. So you should have access to that digital ID card in the last week of September. Does that sound right, Christina?
Yeah, so I want to reiterate, so it should be in the last couple of days of September, if not October 1st. It will be on there. If you download the United Healthcare app, you can register. It'll ask you just for your basic information like your name, date of birth, and social security number. And you can pull your digital cards from there. If that doesn't work, if you don't see the card, give us a call. I can provide the customer service number and we can get that member ID number for you in time for your appointment.
Okay, thank you.
Yeah, and all that contact information is included in your guide as well. So any member services with any of the providers is in there.
Okay.
Can I add something to that, please?
Sure.
Okay, she's going on, I believe, the 2nd of October, she said. Is she going to be responsible if it's an imaging? If she's going to have that, I guess if she would pick the $750 deductible, is she going to be responsible for that?
So everything
I'm
should be coming over
not
from the previous
sure.
carrier. In this case, it would be Humana.
I was gonna say.
Yeah,
Right.
so it really just depends on when we receive the file from the previous carrier. But I do believe that we do something like a claims hold during that period.
Okay, my next question is, this insurance goes in effect October the 1st. Is it from October to October, or in January does it kick in with a new deductible?
January 1 is when the deductible resets, just like with the prior plan.
Okay, are you going to prorate the $750 deductible between October and December 31st?
Yes, sir. Yep.
Okay, thank you.
Yeah, no problem. So anything you put toward your deductible with Humana is going to carry over to UHC, and they'll be made aware of that. So it's not going to be like your deductible is resetting on October 1st and then again on January 1st, if that makes sense.
Okay, so we met the requirements with Humana. It's we're fine until the January the 1st.
Correct.
Yep.
Okay, thank you.
Yeah, no problem.
All right, so this slide here, as I mentioned earlier, this is one of my favorite benefits. I've used this benefit. So you have access to talk to a doctor, 24 hours, 7 days a week with what we call a virtual visit. So these are for those, minor illnesses, like if you have a pink eye, a minor cold, if you have, allergies. It's a quick way to speak to a provider when your provider is not available. You would just have to go through the myuhc.com website or going through a provider that's on the United Healthcare application. And you can see a doctor, they can fill a prescription sometimes on this. I know I've used it to refill one of my nasal allergy sprays that I needed, and it's at a $0 copayment. So non-emergency situations. And included in your medical benefits, we also have the Employee Assistance Program, which is a 100% confidential program. It's to help with things like your mental health concerns, including substance abuse or addiction. If you need help with your relationships, whether that be a marriage, if you need, guidance on anxiety, depression, you can get help with coping with those day-to-day challenges. And the really cool thing about this program is that it includes up to 3 visits per issue per year, and it's at absolutely no cost to you. So what do I mean by 3 visits per issue? So if you're having, let's say, a substance abuse issue, and then you're also having maybe minor depression, those are 2 separate issues. So for each issue, you get 3 visits at no cost. So 3 visits with, a medical professional, whether that be a therapist, a mental health specialist. Really, really cool benefit that's included at no cost. And this is, again, 24/7. You have access to this at any time, and the number is here on this slide. We also offer additional savings. So even if you don't elect a medical plan, let's say you just want to opt in today for the vision and the dental, or maybe just the vision, you do get additional savings. You can get, 10% savings on contact lenses. You can also get a discount up to 35% off for LASIK vision correction. We also have a really good benefit program for hearing aids that offers up to 80% savings on the newest technology hearing aids. We also have a variety of savings on health clubs. I've seen savings on there as well. For pet insurance, if you have, there's also, I've seen tickets discounted for movies and things like that, all through our UHC.com benefit hub. So this is a website you all will have access to if you elect any of the plans today. And my favorite program overall is the UHC Member Rewards Program. So this is a program where you can earn up to $1,000 for completing healthy actions. And some of these actions you're already doing today. For example, just for connecting a tracker like a Fitbit or Apple Watch or even your iPhone. If you connect your tracker, you can earn $65. You can also earn money for getting your annual checkup. So if you go to the doctor and you get your annual checkup every year, you can earn $50 just for that, up to $1,000. You can track your steps. That earns you some money. This is not the full list. This is just a few examples of activities that you can take to earn up to the $1,000. And once you earn that money, what you can do with it, you can redeem it for digital Visa gift cards. We also have a really cool program called the Earn It Off program, where you can use that money and apply it towards the purchase of an Apple Watch. So if you've been saving up for an Apple Watch, let's say you get up to, you don't meet the $1,000. Let's say you've earned $500 so far. You can use that $500 to put towards the purchase of an Apple Watch, and then you would just pay the difference with a credit card. So you can also, like I said, redeem it for a Visa gift card. And you don't have to wait till you get to $1,000 to start redeeming your rewards. As long as you've earned at least $10, you can start redeeming that money. So really cool
Could you I
program.
have a question. I
Yes,
have a
ma'am.
question. Can you redeem it towards your deductible?
No, you can only redeem it towards digital Visa gift cards, the Earn It Off
Oh,
program.
okay.
Yeah, and you can also, we have a gym membership program that you can redeem it towards that monthly membership fee as well. So effective October 1st, you can start earning your rewards. All right, so let's go over the dental benefits. So there are two plan offerings. There's going to be an HMO plan and a PPO plan. So on the HMO plan, this plan has no annual deductible and there's no annual benefit maximum. So essentially, it's an unlimited plan. Your in-network preventative care is covered at 100%. So those are things like your 2 cleanings every year will be covered at 100%. On the HMO plan, any basic care, this is a copay based plan. So there is a list of those copayments that is provided to you on your benefit guide, I believe. And
Yes.
you can see exactly what each service, what the copay would be. And then that plan does offer braces, so orthodontist services. They do offer it for those up to age 19. Now on the PPO plan, that one does have an annual deductible. The deductible is going to be $50 per person, up to a $150 family maximum. Your annual benefit maximum for the PPO plan would be $1,500 per person. And then again, same as the HMO plan, your in-network preventative care would be covered at 100%. And for your basic care, you would have to meet your deductible and then you pay the 20%. Major care would be your deductible first, and then you pay the 50% after. And then orthodontics is 50% covered up to a $1,000 lifetime maximum. And Connor, I believe this is for both adults and children.
Oh, okay.
Is that correct? Is
Gotcha.
that correct?
I'm not 100% sure. Let me, I'm going to reference the summary while we're on the call and double check on that.
Yes. Yeah, I don't think it was specified on the slide. But I know that's one of the questions I get a lot when I go through the dental.
Yeah, let me look at that. Any questions on the dental coverage?
On
All
the
right.
PPO for the dental coverage, the basic care is things like cleanings, dental cleanings and such, or
No, basic care is things like fillings. Cleanings would fall under your preventive care.
okay.
Yeah.
Thank you.
Mhm.
Hi, is there a maximum amount of preventive care that you could go in a year? Like, the cleaning, is it twice a year only, or people that go 3 times a year, or?
Yeah, so it's going to be a limit of twice a year. We do have extended benefits for maternity and children. So that would be the only time it'll be a little different. And just the dental, I just did look it up. It's only for children up to
Yep.
age 19 on
Yep.
both plans.
Yeah, I
So
just confirmed
adults
that.
are not covered on orthodontics.
All right.
So no coverage at all for adults and under orthodontics. So if you have a major issue, you've got to pay out of pocket for that.
That's correct. That's correct. And I will say it's always worth with surgeries like that when it comes to oral surgeries. It's always worth checking with your medical to see if anything would be covered under the medical. I have seen that happen before, especially if it's something that is medically necessary. So, whatever, surgeon you go to that's taking care of that, you can show them your medical ID card and ask them to check with the medical to see if any portion of it would be covered.
Okay.
All right. So for the vision insurance, you are going to be with United Healthcare, as Connor mentioned. For the deductible, well, you have a copay. There's no deductibles on the vision. You have a copay for your annual exam of $10 once every 12 months, so once a year. You also have a $15 copay for your materials and copay. That will be your lenses and frames. If you do need lenses, that's the $15 copay. It's included in the materials copay. And you do get a frame allowance of $130. So if you want the $200 Versace's, the $130, you can apply it, and then you would be responsible for the remainder at a discount, of course. And then contact lenses, you do have as well a $130 allowance on contact lenses every 12 months. And then if they are medically necessary, you do get it 100% covered after your copay. And this is, down here we have some fine print. Your vision plan covers either glasses, which would be your lenses and frames, or contact lenses each year. If you receive contact lenses, they will be instead of your glasses benefit. So it's either or. Any questions about the vision?
Are the frames yearly or 1 year yes, 1 year no, or how does that work?
I'm
So
sorry, you
yes,
broke. Oh,
yeah,
sorry. Go ahead, Christine.
no, I was gonna say, I couldn't really hear. It was very choppy.
Okay, are the frames yearly? Like every year I'm entitled to a frame? So like the frames for the glasses?
So frames are every 24 months.
Okay.
Yes.
That's correct, yeah.
All right. Okay. Well, thanks, Christina. Appreciate you going over the UHC stuff. Does anyone have any final questions on the UHC portion before we move on to the life insurance?
Connor, can you hear me?
Yeah. Mm-hmm.
This is Bill Collins.
Mhm.
I just wanted to mention a few other things that, and I think probably the best news of all of this is that our United Healthcare, our medical insurance is going down 5.5%. So, people are used to maybe some high single digits or double digit increases. We are having a 5.5 lower rate this year on our medical insurance. So that's great for the individual and it's great for the city. The also United Healthcare, I think it's going to be great for people who have doctors or maybe didn't have a doctor in the Humana plan, because UHC has the largest provider network that I'm aware of any carrier. The only thing I would say is if you could, fill your prescriptions now or visit your doctor now this month under Humana, I would recommend that you do that. And the other thing is, this year everyone is going to have to complete an enrollment form. And so we're used to doing maybe a passive enrollment. This will be an active enrollment. Everybody's going to have to complete an enrollment form, and everyone's going to have to choose a primary care physician. So that'll take a little effort, but in the end, I think it'll work out for the best. So thank you very much.
Yep. And thanks for that, Bill. A couple things I kind of want to expand on with that. In regards to the prescriptions, Bill is right. If you do have any prescriptions you need to fill, it is a good idea if you can to get them filled before the October 1st date with Humana. And the reason for that is, when you're transitioning from one carrier to another, no matter what carrier it is, there may be a little bit of a delay, especially if you needed like a pre-authorization for your prescription, okay? Because you're going to have to submit that again through UHC. And there's actually, in the benefit guide, there's going to be a transition of care form in there that you can fill out and get sent to UHC. That's going to help you with that. But if you do have any prescriptions that needed a pre-authorizations with Humana, I would go ahead and reach out to your doctor and say, I'm switching to UHC effective October 1st. Just wanted to let you know that we're going to have to submit another pre-authorization. And then as soon as you get that ID number with UHC, you can submit that to your doctor and he should be able to submit another pre-authorization for you, and we should be able to get that processed. Okay? Any questions on any of that? Okay, great. All right, so now I will go into the life insurance, which is pretty easy. There are no changes with this. It is going to remain through the standard, and you do have that life insurance provided to you by the city of Miami Springs at no cost. Coverage will not be changing. It's going to stay the same. So we do have the three classes here. If you are an active employee, you will fall under class 1. And you will receive 1 times your salary up to $150,000 for coverage on that. If you are a retiree under the age of 65, you do fall under the class 2. And your amount of coverage would be the amount in force at your retirement. And then if you are a retiree over age 65, you would fall under class 3 and your coverage amount would be $5,000 on that. Okay. And then there is an age reduction. That's only going to apply to class 1. So that's only going to apply if you're an active employee, but your coverage would be reduced by 50% at age 70 if you are an active employee. And then of course, if you retire, it would go down to that class 3, the $5,000 in coverage. Okay. Please make sure to designate a beneficiary. I cannot tell you how many times we have dealt with, people that have passed away and forgot, maybe got divorced and remarried, and the old spouse was listed as the beneficiary, something like that, and it's caused issues. So please make sure that you're keeping up with your beneficiary. The beneficiary form is included in your beneficiary guide as well, or I'm sorry, your benefit guide as well. So you can access that through the benefit guide, fill it out, and get it to HR so they have the most up-to-date beneficiary on file. Okay. Any questions on the life coverage? And that is AD&D as well, accidental death and dismemberment. So that's going to match whatever coverage the life coverage is. All right, there are a couple benefits through the standard as well that are offered to you at no additional cost. So these are kind of like added value. So there is the Life Services Toolkit, which is, kind of like an employee assistance program light. So this is going to be kind of an additional benefit to you on top of the employee assistance program with UHC. But that's going to offer resources to you for things like estate planning, health and wellness, and identity theft protection, things like that. And there are more benefits available in there. There is a summary in your benefit guide that you can access that goes over how you can, get to those benefits, what all is in there, all that kind of thing. All right, and then there's the travel assistance as well. So this is a really good coverage. This is going to cover you if you are traveling within the country or outside of the country. So it's going to, provide coverage for you for things such as losing your passport or your credit card, connecting to medical care. Should you need assistance with that outside of the country. Of course, UHC can assist with that as well. But just know that this benefit is available to you too. And there is a summary for this as well in your benefit guide that's going to go over everything that's covered, how you can access that benefit, the phone number, the website, all that stuff.
Hi, Connor.
Yes.
Where is this benefit guide getting emailed to us, or is it?
So yeah, we are getting paper copies to you. I believe they should be there today at the latest tomorrow. So those paper copies should be made available to you. There is also a digital copy, which there's going to be a QR code at the end here, which you can scan and get it on your phone. But I don't know if Bill is planning on emailing it or.
Yeah, we'll make sure. Yeah, they'll be you'll be inundated with it, but we're going to distribute hard copies. I think tomorrow, by tomorrow afternoon, hopefully, or I guess on Wednesday morning at the latest, through the departments, so that everyone will have a hard copy. If your department needs a Spanish manual, we'll have it in Spanish as well. But you have to just let us know so that we get you that copy. And we'll make sure that it's on the on our website as well with links to it, and we'll email it too. So you'll have copies of it.
Thank you so much.
All right, good question. All right, so now I'm going to move on to the voluntary benefits through AFLAC. So again, these aren't changing. These are going to remain the same. There's just a brief summary here. There's also some complete summaries in your benefit guide of all of these plans. But as you can see here, you've got the accident coverage, which is going to cover things, outside of the job. If you were to, have an accident, you need to be hospitalized, you need emergency treatment. They've got different payouts for different things, but it would cover, any of those kinds of accidents. You've got your hospital indemnity, which is going to cover if you need to be confined to a hospital. So you got your ER room benefit for that, your first night confinement benefit, ambulance benefits, those kinds of things. You've got your critical care policy that's going to cover, benefits for things like heart attack, stroke, end-stage renal failure, all those kinds of things. And there's a complete list of what critical illnesses would be covered under that in your guide. There's also the cancer policy, which of course is going to cover if you were to be diagnosed with cancer. It's going to cover things like the hospital confinement, any radiation or chemotherapy, ambulance. There's also a wellness benefit on that policy as well. So if you were, to get your annual checkup, you can submit that to AFLAC and receive a little money back. They'll send you a check or direct deposit, a little extra money for you as well. So that's a great benefit. And then we've got the short-term disability, which is guaranteed issue, meaning you don't have to complete any kind of medical screening or anything. And that's going to cover, your salary based on what your salary is. It's going to cover a certain percentage of that if you were to be out of work for a limited period of time. And then you've also got life insurance available through AFLAC as well. They have several offerings for that. So if you have any questions about any of these products, you can reach out to Sharon Bassoff with AFLAC. You've got her phone number and email there. Her contact information is also in that guide as well. Okay, so if you have any questions or want to enroll in any of these products, you can reach out to her.
Connor,
Yes.
I just received a question from someone about this is about United Healthcare. Apparently, this employee has already tried to register online. So the question was, when and how will we get our identification number so that we can create our account on the United Healthcare app in time for any upcoming appointments?
Sure. So, and Christina, if you're still on the call, correct me if I'm wrong, but no one's going to be able to create an account until their enrollment is in the system. Okay, so until those ID numbers have been generated, they're not going to be able to create an account because there's not going to be any record of them yet. So as soon as we are made aware that the enrollments have been processed, we will let you all know so people can then go in, create their account, and have access to their ID number. But we're also going to get we will receive a full list of everyone's ID numbers as well. So we'll get that out to you, and anyone that needs it, you should be able to provide it to them.
That's
Thank
correct.
you.
Okay. All right. So with all that, just kind of an overview of everything we've went over. Again, here's that QR code to the benefit guide. If anyone wants to scan that, you can have that available on your phone whenever you need it. But again, this is going to be the open enrollment period is going to be open through today, September 9th, and it is going to run through end of day on September 20th. Okay, so make sure everyone you get that enrollment form completed from UHC and submitted before end of day on September 20th. All right, because we've got to key in your information, we've got to get it submitted to UHC, and then they've got to process those enrollments so we can have your ID number in time for your appointments and your medications and all that kind of stuff. All right. Again, make sure that you come prepared with the dates of birth, social security numbers, and names of any dependents that you want to enroll. Remember to review your beneficiaries, as I mentioned earlier, on the life insurance. And again, not to beat a dead horse, but you do need to, if you have any prescriptions that you need to get filled, make sure, if you can, to get those filled before October 1st through Humana. And then, like I said, we're going to make sure to get those ID numbers out to you as soon as we can. So if you do need a pre-authorization for a medication, you can get that submitted as soon as possible, and there won't be any delays in your medication or your treatment or whatever it is. All right. Make sure you select that PCP. So even though you don't have an ID number yet or anything, you can go on the UHC website and search as a guest. You're just going to select the NHP HMO/POS network when you do that on the myuhc.com website. And you'll be able to search for your provider, make sure they're in network. But like I said, if they were in network with Humana, you shouldn't have any issues with them being in network with UHC. And then I already went over the prescription piece. And if you have questions, of course, you can reach out to the HR department there at Miami Springs. That email is going to be benefits@miamisprings-fl.gov. Okay. Any questions, comments, anything at all?
Connor, if I could just add, we're also going to have all of this information. All of this information will be on the city's website. I hear music coming from somewhere.
Yeah.
Someone's,
Sorry. Let me see if I can
that's
mute that, Bill.
I think that's coming from you. I think it's coming from you, Connor.
All right, there we go. I think we're good now.
Right, just that we're going to have all this information, should be on there by tomorrow on our website, and we'll continue to build that. So any forms that you need, any links that you need, those things are going to be available on the HR department website.
Hello, Shakita Days. Will that be a breakdown of what we're going to be paying for the insurance?
Yeah, so all that will be included in the benefit guide. The rates for the medical, dental, and vision will be in there. So you'll see what your per pay period cost would be.
Thank you.
Sure.
And the city will continue to provide at no cost to the employee individual silver plan coverage. So the additional insurance is going to be at a lower rate than it was last year under Humana.
Thank you.
All right. All right. Well, if no further questions or anything, thank you all for your time. I appreciate you sitting through the presentation, and thank you for all the great questions. There's been a lot of really good questions and feedback, so we appreciate that. And we hope you have a good year with City of Miami Springs, and hope you all have a good rest of your day.
Thank you, Connor.
Thank you. Thanks, Christina.
Thank you, Connor. Thank you, everyone.
Thank you, Christina. Thank you.
My pleasure.